My name is Carrie Donnelly, and today I will be discussing theory and counseling approaches to achieve therapeutic lifestyle changes. To start, I'll just provide a quick overview of what I'll be discussing during this presentation, starting with setting the stage. So this is prior to meeting with clients, and we'll talk about the importance of the therapeutic environment as well as building the therapeutic relationship. Next, assessing a client's readiness to change, and this is where the trans-theoretical model will come into play. And finally, how to apply motivational interviewing to support our theory-based counseling approach. The goal is to create a welcoming environment conducive to health behavior change. This starts with being confident in understanding your own personal values as a counselor, as well as your worldview and any potential biases. So also being culturally and socially aware of your clients and respect their diversity as well as their personal values. So overall, this will create an inviting, safe, judgment and bias-free environment. Next, the therapeutic relationship. So clients often express that the personal interaction with their provider is the most important part of their treatment. As I said before, establishing a non-judgmental environment and relationship means clients do not feel as if they're being criticized when difficulties occur. Rather, you should be there as a support system and understand as a provider. A few characteristics of effective counselors. Knowledgeable. Also, you must have ethical integrity. You must be a clear communicator, as well as being honest and genuine. Maintain a sense of optimism and hopefulness, and what I think is most important is maintaining a sense of empathy. So another way to develop an effective therapeutic environment and relationship for behavior change is to shift away from the expert-client approach to a client-centered collaborative format. So this was initially practiced and taught by Carl Rogers, and also known as Rogerian counseling because of that. The goal of this is to form a collaborative client-driven discussion to explore client needs, problems, and potential solutions free of any judgment. So next, discussing a client's readiness to change, and this is an overview of the trans-theoretical model. So to inform my counseling session, I rely on this model, and this describes behavior change as a dynamic process involving progress across stages. And throughout this, you can gauge one's motivation and their readiness to change. So we'll start with pre-contemplation. That's the first step in this model, and during this, clients have no intention of changing within the next 6 months. They are often in denial or unaware that a problem exists. After this, they shift towards the contemplation stage. To be in this stage, a client has to recognize that there is a need to change, but they're still in a state of ambivalence. So they alternate between reasons to change and not to change. And this is a really key point for you to be as a counselor. If they were asked, they have intentions to change within the next 6 months. Next, they move on to the preparation phase, and this is when a client starts to believe that advantages to change outweigh disadvantages. They are committed to taking action within the near future, as soon as the next 30 days. After preparation, they move towards action phase, and they agree to alter their target behavior to an acceptable degree. So this is the phase within 1 day or up to 6 months, and they have to continue to work at it as changes are not viewed as permanent. During the maintenance phase, they will have actively been involved in a changed health behavior for more than 6 months. But still, it's always a process to maintain this behavior, and your role as a counselor during the maintenance phase is just as important as any other phase of change. To apply this in a counseling session, so the trans-theoretical model can be used to gauge one's motivation or readiness to change. When you know what stage of change a client is in, you can then tailor your intervention in order to best meet the needs of the client at their time. Next, we'll talk about motivational interviewing. So this is a communication method used in counseling, and it's developed to promote one's personal motivation to change. So this really ties in well with the trans-theoretical model. The goal of motivational interviewing is to encourage internal motivation, choice, and self-actualization. So motivational interviewing is a framework that consists of quite a few components, one of them being the spirit. So this is the central philosophy of motivational interviewing, and it focuses on 4 areas. So motivational interviewing should be a partnership, and this is a collaboration between provider and the client. We've discussed this prior in the presentation. This ensures that knowledge and experience and expertise of both parties are treated as equal. While a counselor may be the expert on the health information side, only the client is aware of their own experience, and that is the area that they are an expert on. So that's partnership. Next, acceptance. The counselor always meets the client at their current state of change and provide what they need at the current time. This ensures that they respect the autonomy and the client's sense of self. Compassion, I believe this goes hand in hand with empathy and is very important to a counseling session. So this allows clients to explore their current health behaviors and health beliefs without any judgment. And finally, evocation. This is the idea that it's the job of the counselor to act as a facilitator to the autonomous desire to change. So the goal of motivational interviewing is to develop and promote internal motivation to change, encouraging choice and self-actualization in your clients. In order to do this, 4 skills are necessary, and they're referred to as ORs. Starting with open-ended questions. Just yes or no questions really limit the amount of information you'll receive from a client, so try to make them open-ended, allowing for a discussion-based counseling session. Next, the use of affirmations, just positive reinforcers. When you hear any desire to change, it's good to pick up on that and reinforce this. What I believe is the most important thing is listening, which is why I put that nice little picture of that animal with the huge ears. Reflective listening, you rephrase and repeat what a client has said and hopefully reinforce any ideas or thoughts, feelings that they have towards change. And finally, summaries is just another way to essentially reiterate what the client is saying, summarize their key points, and maybe minimize some lesser issues. This will help keep the counseling session flowing, as well as checking in to ensure that you really are understanding what the client is saying. So, although 2 different models and approaches, the trans-theoretical model is often used in conjunction with motivational interviewing, and I think they support each other really well. So unlike other behavioral change approaches that assume a client is in the preparation or action phase of change, the trans-theoretical model acknowledges that individuals may not be committed or ready to change. And this is where motivational interviewing could enhance this approach, and by highlighting ambivalence and encouraging and promoting intrinsic motivation to change. So using motivational interviewing can, like I said, facilitate their autonomous progression through each stage of change. It can resolve any ambivalence in the early stages of change, but it is also can be used in the later stages of change, like action and maintenance, to prevent any sort of relapse in the client. So the use of the trans-theoretical model and motivational interviewing can successfully elicit a patient's motivations, obstacles, strategies, and strengths, and this will help them discover possible ways forward by taking small steps that will lead to a healthier life. And finally, these are my references as follows.